Hi, good afternoon. I'm Dr. Tassin, the Chief Medical Officer for FastMed Urgent Care in Arizona. And we're at a clinic directly across the street from Hamilton High School where there have been 2 reported cases of mumps. Mumps is an infectious illness caused by a virus, and it causes what is known as parotitis, which means inflammation of the parotid salivary glands, the big saliva glands right in front of your ear. Sometimes it has a pre-illness of fever, achiness, headache, muscle aches, but sometimes it has no symptoms at all. Up to 1/3 of people with mumps actually have no symptoms. For those who do have symptoms, the most common thing is painful swelling of one or both of their parotid salivary glands. It's caused by a type of virus, so antibiotics don't work, they don't affect this infection, and the treatment is completely based on symptom relief. Fever management, anti-inflammatory drugs, good hydration, and generally supportive care. Mumps is preventable by vaccination, and the vaccination series is 2 shots. One is usually given at about 12 to 14 months, and one is given somewhere between 4 and 6 years. The vaccine is variably effective. Different reports are as low as 68% or as much as 95%, but it's not a vaccine that is absolutely 100% effective. And because of that, even a person that has been vaccinated can still get mumps. So just because a person has been vaccinated does not mean they can't get mumps. Mumps does have some pretty serious complications, and the most common that people know about is mumps orchitis, which is inflammation of the testicle, which can lead to reduced fertility. Females can also get inflammation of their ovaries, but it does not affect their fertility. Mumps can also cause inflammation of the pancreas in the abdomen, which leads to abdominal pain and vomiting as a sign of pancreatitis. And mumps can also cause eye complications, inflammation of the front of the eye, and about 1 in 15,000 people that gets mumps will have nerve deafness in one ear. And the best way to prevent getting mumps is to receive the vaccination. Mumps is an infectious illness that is spread through respiratory secretions. So when a person has inflammation and infection of their salivary glands, every time they cough or sneeze, they spew out microscopic droplets of saliva and mucus, which is kind of gross when you think about it, but you know, we're mammals and that's what we do to each other. So it is spread by respiratory means, which means that coughing and sneezing and direct contact with saliva and secretions is the way that the infection is spread. The incubation period is fairly long, 14 to 24 days. And because of that, if a person is not vaccinated, their social isolation after a presumed exposure means that they need to be out of public circulation for 26 days after the last case is reported at the location where they may have been exposed, which has pretty big implications for our students.